Political editor Michael Brissenden, and in the wake of last week's acknowledgement by Mr Howard that he'd step down as Prime Minister sometime during the next term, if he wins his fifth straight election, there's a notable strategic coalition shift away from selling the leader to selling the team. The Prime Minister and his Cabinet colleagues are suddenly keen to stress that, person for person, the government ministers outshine their Labor counterparts. We've taken that as a cue to stage some more of our occasional debates on the big issues of this election. As today's parliamentary debate again reminds us, health will be a key issue this time, with particular emphasis on the public hospital system and basic medical care. To talk to their vision for the next term of government, I'm joined now in our Canberra studio by Health Minister Tony Abbott and Labor's Alternative Minister Nicola Roxon. Tony Abbott, you've written for an upcoming magazine article that, quote, on any fair judgment, Australia has excellent health systems. Do you include public hospitals under that banner of excellence? And to the extent that the Commonwealth can, what plan do you have to improve the public health systems over the next 3 years?
Our public hospital systems could do better, Kerry, but they aren't bad by world standards. It's not up to the federal government to run public hospitals. Our public servants would be just as effective as state public servants at running public hospitals. What I want to see come out of the next healthcare agreements, though, is a funding system which is about funding better health services. It's not just an arrangement between governments funding big bureaucracies.
But how do you do that?
Well, for instance, you could fund the public hospital system on a case mix basis. That would force them to focus on services rather than on global budgets, and it would mean that you would be getting what you paid for in a way that the Commonwealth can't be sure now.
So when you're talking about excellence, and I know that's a broad banner, but when you talk about excellence, how do you set that against the queues for emergency care and surgery that have been around for yonks, and complaints about lack of adequate follow-up care?
Well, these are problems, and they're problems that the state governments should be addressing. I'm not proposing to solve all their problems for them, because I don't believe that that's the federal government's role. But I do want the next healthcare agreements to, if you like, backseat drive the hospitals into a better position than they are now. And I think if we focus on funding services rather than just shovel an enormous pot of money into the state's coffers, we're more likely to get good services delivered to patients.
Nicola Roxon, what are the key planks for Labor that a Labor government would rely on to improve Australia's public hospitals if you're elected?
Well, Labor's already announced a $2 billion health and hospital reform plan. We do believe that we can make our health system even better, and I'm surprised to hear Tony say that he has this interest in the healthcare agreements, because several months ago he refused to start negotiations with the states about these sorts of changes. In fact, seemed to have clocked off, if you like, as Health Minister. I think we do need to have serious negotiations with the states about how we reform our healthcare system, both hospitals and frontline community care. And our $2 billion that we've put on the table is going to be directed towards dealing with issues like preventable hospital admissions, pressure on our emergency departments, how we treat older people in a more appropriate way, preferably out of hospitals and in more appropriate settings for them. These sorts of things are really huge future challenges for the health system, and my concern is that Tony seems to have lost interest in pursuing these big issues at a time when we really need to be retooling and re-equipping our health system for the challenges of the future.
But you would have the same constraints, the same constitutional constraints as Tony Abbott in terms of what the Commonwealth can do against what the states deliver in frontline care. Now, you've talked about a Health and Hospitals Reform Commission, but what's that going to do?
Well, we've already said and put $2 billion on the table to kickstart this reform. We've made clear that we're prepared to put extra money in the system when the Howard government has taken it out. We will establish a reform commission because we think there are long-term changes in our system and the sharing of responsibilities between the Commonwealth and the states that could be improved, and we could make every health dollar go a lot further in providing better services for the community.
But
we're not afraid of that reform, which I think the government has lost a bit of appetite for, but actually the health challenges of the next generation need us to be prepared to look at those things.
But what's the stick in the carrot and stick with that commission? Why would that commission get any better result out of the states than any federal government has got out of them in the past.
Well, the stick in that we've made very clear, and Kevin Rudd has said that the buck will stop with him when it comes to his commitment to these reforms. The stick is that if we cannot get sign-on from the states to actually be part of a needed reform process, we will ask the community, we'll seek a mandate from the people to take over financial control of the hospitals. Now, we won't do that without talking to the community, because it would be a big change, and we would want to make sure that that is endorsed. But we'll only do it if cooperation is not successful.
Now, you're not impressed by that at all, are you, Tony?
Well, it's not a hard plan.
You've likened this commission to the British National Health System.
Yeah, look, it's just another talk fest. It's just another talk fest. Now, you know, there's something for everyone in the Rudd plan, but it ends up being really nothing to anyone. First of all, you've got this big talk fest. Then we're going to have 2 years of cooperative federalism. If and when that doesn't work, we're going to have the ultimate act of uncooperative federalism, namely a Commonwealth takeover. But there is nothing specific here. It's basically a trust me policy. Elect me and I'll make it up as I go along. Now, I think the Australian public deserve a lot better than that.
Briefly?
I think that's a ridiculous position. We are setting out a plan for the future, not just for the next 10 weeks, as the Howard government seems to be doing, whether it's for the Mersey Hospital or other one-off initiatives. This is a national plan for the next 10 years, and we need to do it carefully, and we intend to make it work.
Tony Abbott, when you talk about sort of this kind of ad hoc thing, or talk fest, it's only a couple of weeks ago, or a few weeks ago, that the Prime Minister announced the bailout of the Mersey Hospital in Tasmania, which you've since dressed up as testing a new community-managed model that could become the model for a wider introduction.
I haven't since dressed it up. That's always what it was, Kerry.
Well, I have to say, in the first couple of days, I remember in our interview you said that you painted this as something that could be a massive shift, but then a day later you said it wasn't for wider application.
Well, no, it is a new model and a better model, I think, for running public hospitals. And I would like to think that if and when this is operating, and operating well, the states might adopt it, because certainly a community board, a local hospital board that is responsive to local patients and local clinicians, is going to manage these hospitals better, by and large, than a giant faceless bureaucracy. And the problem with Kevin Rudd's plan, if indeed it can be called a plan, it's also vague and also contingent, is that substituting Commonwealth public servants for state public servants is not actually going to help.
Nicola Roxon, is that a new path to consider, the idea of state-run hospitals remaining as state-run hospitals but managed by the local community?
Well, look, I think that all sorts of options are possible, but I think that was a fairly noble effort by Tony to rewrite history when he's been absolutely all over the place about what this Mersey Hospital takeover means. He's been all over the place about whether he thinks it's a good idea for the federal government to take over state-run hospitals. We've set out a comprehensive national plan which is part of a whole strategy. It's not just about one hospital in one electorate, in one marginal seat that the government wants to win. And I think that the public will embrace a government or an opposition that wants to be a government planning for the future, looking long-term, not just at these one-off solutions, which aren't necessarily going to be successful.
Tony, yes, sorry, go on.
Nicola can't give us any of the real details. I mean, that's the whole problem. It's a trust me strategy. She talks about the $2 billion public hospital fund, but even since it was announced, it's already being raided for things like GP clinics. Now, I mean, it's a pre-election health slush fund, and even if it was all going for public hospitals, $2 billion over 4 years, $500 million a year, it works out at about $700,000 per public hospital. It's not going to solve too many problems.
By the same token, it's not that long ago that you were floating the idea of the Commonwealth taking over the states and having only one level of hospital management. What happened to that?
Well, what's happened is that I have moved on because I have discovered more about just how difficult it is for any group of public servants to try to run things on a giant top-down basis. It's not which level of government runs the public hospital systems which count. It's, are they well run? And I reckon this model that we are putting in place at the Mersey offers a lot of potential for better run public hospitals, whether in the end it's the Commonwealth or the states which are ultimately taking responsibility.
Nicola Roxon, I can imagine that some people might find the idea of a federal takeover of public hospitals a rather attractive proposition, but it sounds, on what Labor has said so far, that they wouldn't want to be holding their breath, waiting for a referendum that would change the Constitution and allow that. That's so, isn't it?
Well, look, this is in the hands of the states to some extent. We've made clear that we are going to demand changes, that we are going to demand better services for the community, and we're prepared to put money on the table at the Commonwealth level to help make that happen. But if for some reason the states are not prepared to negotiate with us or don't want to pull up their socks or drag their feet, then we are prepared to ask the community for endorsement of a proposal for us to take over funding for hospitals. We can't be clearer than that. It's not our preference. Our preference is to get better outcomes through cooperation. And we haven't seen for the last 11 years what might be able to be achieved if you had a government that was actually prepared to work with the states and territories. Because Tony's government, his government has taken $1 billion out of hospital funding, and that of course puts pressure on the sorts of services that can be delivered. We think that working with the states will be able to deliver better outcomes, but we're not going to sit around and just wait month in, year out. If it doesn't happen, we will go to the people asking for their approval.
Sorry, Tony Abbott, with the time that's left, I'd like to focus on medical care from doctors.
Sure, Kerry, but she still hasn't explained how they're going to pay for this takeover and what changes will have to be made to the GST arrangements.
We'll leave that here because, I imagine,
but it is a pretty big question.
All right, it'll mean sacrificing time on doctors,
sure.
But how do you respond to that? But Tony Abbott says you still haven't explained where your funding is going to go, and he says $2 billion over 4 years is simply not much money at all.
This is $2 billion of new money that is being put on the table that has been funded from a range of savings which we have already announced. The Howard government, in contrast, has not been prepared to find any new money. It hasn't actually made any commitments about what it's putting into the healthcare agreement in the future, and the minister's gone off on smoko, won't actually talk to the states about negotiations at all. So it's a bit rich to ask for him to ask for the financial sorts of details that he is not prepared to give from government.
We are going to have to leave that issue there. Tony Abbott, are you fundamentally satisfied with the service offered by general practitioners and specialist doctors and the fees charged, and in terms of the available service, with the exception of some rural centres? And are you satisfied that there are enough new doctors in the pipeline to solve the doctor shortage over the next few years?
I'm not saying that the system is perfect, but I think it is a good system. And yes, from time to time people do get hit with fees, sometimes quite high fees, and that's why the Howard government's safety net is so important. Last year it stood to benefit 1.5 million Australians to the tune of some $260 million, and Nicola still can't explain what Labor is going to do with that safety net. At the last election they promised to abolish it, and they still haven't made up their mind what they're going to do at this election.
Brief response.
Well, what's interesting is the safety net has become a necessary part of our health sector because of the pressures that have come on the working families to pay for health care, for dental care and for other services. 1 in 3 Australians now report that they don't go to the doctor or dentist because of cost. And Mr Abbott shouldn't be proud of the fact that this is needed, that so many people are under pressure for cost.
Okay, but if it's necessary, Nicola, you're going to have to keep it, aren't you?
Well, I know that Tony doesn't like to be kept in suspense for anything, but we will announce our policies in the lead up to the election when it's the right time for us, not for Tony.
Very quickly, Nicola Roxon, what would your super clinics of GPs and other health professionals achieve that isn't available now? That comes in under the $2 billion umbrella, as I understand it, about 200 million of it.
Look, this is a really important investment in frontline care for the community. We've been told by many, many people, health professionals and others, particularly in rural communities, that we are actually not able to provide services because infrastructure is expensive, young doctors are finishing universities now with very high fees that they have to repay, they won't buy into practices that they're not sure if they can sell. If we can actually put in money for infrastructure where young doctors can be trained, where they can work with other health professionals, where we can really attract investment in areas that are underserviced by Commonwealth-funded programs, we know that this will make a real difference.
Tony Abbott, you've had your criticisms of that as well. What's wrong with that?
Well, look, we are doing much of this, but the problem with Nicola's scheme is that it looks for all the world like the government setting up private practices in competition with the private profession, and I think there are certain serious problems there.
Well, that's not what's proposed, because local professionals and local communities will bid to run these services. It is the government paying for infrastructure which is needed, and the government has a failed program of its own, the Rural Medical Infrastructure Fund, which has been underspent by millions of dollars, already recognising that this sort of proposal can work, but this is a much more significant approach for us and a much more significant investment of funds.
Tony Abbott, if these new super clinics take some of the pressure off the public hospital system, surely that's a positive.
But you are assuming that these things don't already exist, and they do. I mean, there are now dozens and dozens of really outstanding general practices that are more like massive primary healthcare centres. They've got GPs, they've got practice nurses, they've got part-time visiting specialists, they've got a pharmacy on site, they've got diagnostics on site.
And what's wrong with funding them in areas where they don't exist?
Because they're operating on a fee-for-service basis under Medicare, and you get what you pay for. And the problem with this bureaucratic scheme that Nicola's come up with is that it's just extending the public hospital problems to our primary healthcare centre, which is certainly not the way to go.
Well, that's just wrong. That's not what our proposal is. That's just not wrong. Our proposal is to have fee-for-service in exactly the way that Tony described. We're just going to make sure that it gets into those communities that currently don't have access to those types of services.
You explicitly talk about salaried doctors in these clinics. Salaried doctors
we
paid for by the
explicitly
government.
rule them out, as you know.
And I have to explicitly end the debate right now, but there's clearly room for at least one more of these during the campaign.
I look forward to it, Kerry.
Tony Abbott, Nicola Roxon, thanks for joining us tonight.